Hi, Haleigh. Thank you for coming in today. My name's Miranda. Can you tell me about what brought you in today?
Yeah, I was in a car accident and my boss said that I needed to get a note so that I could come back to work.
Okay, I'm sorry to hear that. When were you in an accident?
It's a couple weeks ago,
Okay.
not too long ago.
And were you hurt at all?
Yeah, I banged up my wrist and my jaw pretty good. But,
Okay. Um, how are you doing since the accident? What is your pain like?
I'd say that my pain is probably like a 4, kind of throbbing.
Okay. And what are you doing to help alleviate the pain right now?
Just Tylenol, ibuprofen.
Okay. All right. Are you set up with all of your follow-up appointments after the accident? Okay. And can you tell me what was going on when you had the accident?
It's fine, I was just on my way home from work.
Okay, all right. Um, what about any past medical history?
No, nothing really. I'm fine.
Okay. Um, it looks like that when you were in the accident, your blood pressure was pretty high that time that you came in. Is that normal for you?
No.
Okay. Um, and it looks like that your blood alcohol was a little high at the time of the accident. Um, can we talk a little bit about your alcohol use?
Fine.
Okay. Thank you for agreeing to talk with me a little bit about this. Anytime that we can have an open discussion about alcohol use and stuff like that, we can try to develop better outcomes for you. So thank you for agreeing to that. Um, so it looks like that you did our audit assessment. Did you have any problems completing the assessment?
No.
Okay. Um, it looks like you scored pretty good or pretty low, uh, a 10 out of 20. So that's good. Um, can you tell me, would it be okay if we talked a little bit about some of the answers to your questions?
hmm
Okay. So you said that that you drink between 5 and 6 drinks a week. Is this all the time? Can you just talk to me a little bit about your how often you're drinking?
I mean, I drink pretty much every day.
Every day. Okay. And how much do you drink every day?
Um, 6 to 7 drinks a day.
Okay. All right. So maybe your audit score would be a little bit higher than what we had initially
Mhm.
gotten. Thank you for sharing that with me. So, how um, do you think that your alcohol use has affected your life?
I mean, it's fine. I mean, it just kind of helps me get through the day. I mean, my husband and I fight a little bit about this, but it's fine.
Okay. All right. So your husband doesn't like your drinking that much, and sometimes you guys have fights about it.
Yes.
Okay. All right. Um, what do you think are some cons to your alcohol use?
I mean, like in the mornings, it's hard to wake up and I'm like hungover and I have to have a drink just to get started again. But I mean, other than that, it's fine.
Okay. So, one of the cons you're saying is that it makes you feel really bad in the morning
Mm,
and um, you feel like you need it to get started during the day.
mm,
Okay. Um, let's see. It seems like that this is affecting your life a little bit, and I know that this was kind of difficult for you to share with me. So, thank you for sharing your honest answers with me. Um, I did just want to give you a little bit of information since you had some high blood pressure at the time of the accident. Using alcohol can actually cause you to have chronically increased blood pressure, which can lead to a myriad of other um, medical problems like stroke, um, coronary artery disease, things like that. Um, is did you know that?
no, I didn't.
Okay. Um, yeah, so there's just a quite a few medical things that will happen with chronic alcohol use. So let me ask you this. How I have this little ruler right here, and it says between not ready for change and ready for change on a scale of 0 to 10, 0 being not ready at all and 10 being ready. How ready do you think you are to make a change?
Um, I guess I can see how it's a little bit of a problem. So I guess a 5.
A 5? Okay. So you're saying that you're somewhere in the middle between not at all ready and ready to change.
Yeah, just kind of thinking about it.
Okay. Can you tell me maybe one or two things in your life you think would improve if you were to drink a little less?
Um, I mean, I probably might hang out with my friends a little bit more. It's just that I get so tired, and by the time I'm home, I'm just drunk, so I don't want to see anybody. And I probably might fight with my husband a little less.
Okay. All right. Yeah. So you're saying that if you were to drink a little less, you think that it might improve your relationships both with your friends and with your husband.
Yeah, probably.
Okay. Well, those are definitely two great reasons. Thank you for thinking of those and sharing them with me. Um, so as far as like moving forward, just because so far we've kind of talked about how this you were using alcohol and that has affected your life by causing you to have arguments with your husband, and you were in a car accident that left you with some physical injuries. And then there is a risk of increased medical conditions after using alcohol. Do you think that maybe we could discuss setting a goal for you um, to start decreasing your alcohol since you are at a 5 on the ready to change scale?
Yeah, I think so.
Okay. Um, what do you think is a realistic goal for you?
Um, well, I guess I could drink a little less,
Okay.
like a day.
All right. Um, so I think it would be better for us if we were able to set a specific numerical goal, because that will help you have a keep it. So you said that you usually drink every day, and you usually drink 6 to 7 drinks a day. So what if you were to only drink on the weekends?
I can try.
Okay. Thank you for agreeing to try. Um, and then definitely we can have a follow up where, or even just when you come back to continue with the medical care for your wrist and your jaw, we can assess how you're doing with this goal. All right. Thank you so much for talking to me.
Yeah, of course.